Okay. Well, yes, and welcome to the Trauma Informed Care Network presentation by Dr. Paul Callister. He is going to be presenting on um, group psychotherapy and trauma healing. A couple things, a couple housekeeping items just before we get started. So TICN or the Trauma Informed Care Network, is a nonprofit organization that was co-founded by Kristen Warnick in 2013. And our mission is outreach, networking, and education concerning topics, anything concerning trauma or resiliency. It's for practitioners and community members alike. Um, we are offering CEUs for this presentation. So if you are interested in a CEU, I'm going to put the email in the chat down below. But it's just ticnutah@gmail.com. So if you can email, if you're interested in obtaining a CEU, that's great. I can get that out to you. And then also, if everyone would go ahead and put their name in the chat, just so we can have a record of who was present for this meeting, that would be great.
You put my name too.
Okay, you go right ahead, Paul. Okay, and then yeah, let's see, let me tell you a little bit about Paul. Yeah, so Paul is a licensed clinical mental health counselor and certified group psychotherapist who specializes in group therapy. He earned his Ph.D. in counselor education from Oregon State University in 2022 and his Master's of Education in Counseling from the University of Utah in 2010. Dr. Callister has extensive clinical experience in diverse settings, including the Utah State Prison, community mental health, and private practice. He currently owns and operates Utah Group Therapy Center and Bountiful Counseling in Bountiful, Utah, where he leads weekly interpersonal process groups using a modern group and analytic approach. Dr. Callister is training at the Center for Group Studies in New York City, holds the certified group psychotherapist credential, and teaches group counseling in the clinical mental health counseling program at Utah Valley University. His work is grounded in the belief that the group becomes a living laboratory for life, where learning to engage authentically, navigate conflict, and risk connection creates change that extends far beyond the therapy room. And with no further ado, Paul, we will turn it over to you.
Hi everyone. My name is Paul, and it was kind of fun listening to that. My very favorite part was the last sentence or so, and I saw a couple heads nodding. Claire and Nate, I saw your heads nodding, which you guys are the only ones whose video I can see, besides myself and Amy. But it was nice to see your heads nodding. I'm glad to be here. I volunteered to present on this because I'm passionate about group therapy, and I hope we can have a good time tonight. I'll just say, to help me be more present, I did a 5-hour marketing retreat today in which some expert just kind of went through everyone's thing, and I like heard basically 5 hours of coaching for lots of things, and I probably got like half hour, well, maybe a little less than half hour myself. And so I think I have like not quite a headache. I can't tell if it's like a pre-headache or a post-headache, but I'm really glad to have this part of the day. I hope it will be more interactive. Um, I guess I want to ask, let's see, let me switch screens for a second. The title, the title of my presentation is We Don't Heal in Isolation, The Power of Group Connection and Trauma Recovery. I guess to start, we're kind of a group here, and I wonder if I could just ask everyone to like briefly introduce themselves and maybe say what brought you to this tonight. And I'm guessing there's some people here who aren't going to be able to turn on their video or audio, but I would definitely encourage all of you. I guess when I do groups online, I try to do what I can to make the groups as much like an in-person group as possible. I'm so grateful for the technology that we have, that we can meet for convenience purposes and other things, and our bodies, geography and different reasons, and also our bodies. I think the neurobiology of the interpersonal connection is we're not wired for this electronic stuff. And so we've got to, I think anything we can do to make it more like an in-person group, the better. Anyway, nice to see your face, Lori. And is it Dennett or Danae?
Jeanette.
Dennett. Okay.
Yeah.
And along with that, I would say, I guess I wasn't planning to say this, but I'm just trying to think about how to set this up so we can hopefully have some good success. Um, if you can turn on, okay, I see, Kristen, your message. You're in a place, but where you can't talk, but hi, everyone. Hi, Kristen. And thanks for hosting me, Kristen. So if you can leave on your video, that would be great. If you can't, then of course that's fine. And I'd also say, I think there's at least during the pandemic, there was the etiquette or netiquette to like mute unless you're talking. And I find that like the mute button could be an extra barrier for connecting. While I'm going, if you have any kind of comments, you can raise your hand, or if I'm looking at my slides, you might have to speak up. But I'd encourage you to speak up. And I guess I'd encourage you, especially when we have a discussion part, but even through the whole thing, unless there's a flushing toilet or a siren, to just consider unmuting yourself and just leave it unmuted. And if it becomes a problem, you can mute. Also, although I've noticed Zoom, I don't know, the last year or two, maybe Zoom's made all this technology that kind of makes it hard to hear actually a siren or a flushing toilet in the next room. Okay. Susie said, I'm on my shift to my other job, so cannot fully participate. Okay, that's great, Susie. Thanks for putting that into words. Well, I wonder if we could just go around, partially for me to just kind of attune to you guys who is here. It'll probably help me again to be grounded and just start to connect a little bit. I wonder if we can go around and everyone just say kind of what brought you here and anything you want to say about your interest in group work or who you are.
I
My
can go
name's Paul
first.
Callister. I'm the presenter. Go ahead, Laurie.
Um, the title stood out to me because I was nodding when you were saying, we have all of my voice does this thing. When we have all this technology and people are working from home, I've thought for pretty much since COVID, since we could go back to work and people didn't, I have thought like people are going to miss out on the synergy that happens in our nervous system, like the co-regulation and how ideas are generated if they're working distance and they're not experiencing people in real time in real space. And so that was what I was nodding at when you were doing your intro. But the title stood out to me because I have a lot of my clients that are in isolation through various reasons. And I know the value of having created my own support network and community and how I have to work to maintain that. And so I just wanted to participate with like-minded presenters, and I weep very easily.
Oh, you weep very easily.
Yeah,
Okay. Have I
yeah.
managed to make you cry yet, Lori?
I'm already teary.
Oh, okay. Do you want to put into any words? If that was enough, that's great. But do you want to put into any words what your tears are saying to us about being here or the topic or COVID or this topic can bring up a lot.
I think it's that just that someone appreciates um, the power of both sides, right? The power of isolation as well as the power of community and being in connection with people. That's moving.
Okay, well, awesome. Um, I I saw the text, so I'll read that in a second from Corey. But I'll also say, if you're talking about connection and some of the ways that like a lack of connection can lead to anti-mattering and the importance of mattering, which includes being seen. So I was thinking about this, I was reading an article about this, being seen, knowing that we're important to others, and also knowing that others need us, this kind of power of connection. And anyway, the ideas you're saying, I can join you on that. Thanks for sharing. Okay, I'm going to read Corey's message. Corey said, I was interested in the relational aspect of healing. Yeah, that's what the whole topic is about. Thank you, Corey. Okay, whoever wants to go next.
I can go next. My name is Danette Barnett, and I was interested. I'm not currently, I have my license, but I'm not currently in the profession at this time.
Mhm.
Just maintaining my license, but my favorite work is group work.
Oh,
And so I think that is what really drew me to it.
wow. As you like smiled and paused, then I could hear like the richness of like the love in your voice that like really warms my heart tonight.
Oh, thanks. Yeah, it was really so fun, and I can't wait to get back to it someday.
What do you love about group work?
I
If you
really
know.
like, I mean, what you said about it is, it really is, we get to see people who, for what they are, for like their strengths and also things that can be barriers for them. And it all comes out to play in group work. And it's not only me as the facilitator, um, like guiding them, but really just letting group members process that themselves with me still facilitating it and guiding them along. But it's not all me. It's just,
Yeah.
I'm just guiding them.
I have this vision like when it goes well, and sometimes I hate my groups and sometimes I love my groups. I have this vision of like orchestrating something, and when you see the flow, it's like it's not like sitting by a river, but it like although that image comes to mind, it's just kind of can be magical and seeing the group
Mhm.
do its thing too.
Well, even like when hard things are brought up, like if you weren't really listening, or you're coming into late all the time, like it just all comes out into play, and it's really things that they're going with in their own life, but it's coming out in group work as well, so we can kind of just process that.
Yeah. Tell me if this fits, Danette. I've heard someone say it's totally an overgeneralization and it kind of devalues individual therapy, although I love individual therapy too.
Mhm.
But I've heard some people say people come to individual therapy to talk about their problems, but they come to group to work on their problems. There's a way in which if we work in the here and now, that their problems like show up here, right in the group.
Mhm.
Does that fit
Oh yeah,
with what you're saying?
yeah.
Okay, cool. Okay, let's go. Who wants to go next?
I'll go next.
Oh,
Oh,
Amy,
and then
Amy.
Nate. Okay.
Oh, and
Well,
Amy, sorry, I don't want to give you any directions. You're my host, but I wonder if you'd mind putting your name in your thing just to make sure everyone can know how to refer to you.
I don't know if I can because this is the Healing Pathways Zoom. So
Oh,
I'm
okay,
not sure
okay.
if I can. Yeah, but I'm Amy Jefferson. I am the Trauma Informed Care Network program coordinator. So that is why I am here tonight. But I do have a keen interest in group work, actually. I come from a substance use treatment background, and the group modality is used like prolifically in substance use. I think it's well accepted now that connection is the opposite of addiction, and if we really look at what's under addiction, it's trauma.
Mm, mm,
So like therefore, right, connection aids in trauma recovery, and I know Bessel van der Kolk has talked too about the importance of connecting, right? Like not only with self, but with others and reintegrating into a community to aid trauma recovery. So I personally have seen the power of groups in my life and groups that I've been in, and then groups that I've seen utilized in the substance use disorder space. So yeah, I'm a big believer in groups, and I'm just
Mhm.
happy as a clam over here to get to sit in on this presentation. So
Good. I hope I don't disappoint you too much, but that's exciting. I can feel some of your energy.
yeah.
And it makes me think of yeah, the attachment perspective. I'm not sure if you said that word or not, but that
Mhm.
addictions are competing attachments. And
Mhm.
I was thinking about that earlier today.
Yeah.
Okay.
Yeah, I would love to go. I was so stoked when I saw the title of this. Um, I've read some Yalom at this point, and I love his idea of um like wounds from other humans have to be healed in the space of other humans. And I feel like
Mm.
individual work does a good job of that. And I come from a residential and school-based background. And so I would watch people's defenses slowly just melt as they were in groups and really like connect in this beautiful way. And it was honestly one of the things I loved the most about I wasn't running the group at the time, but um it led me toward the field of psychotherapy because it feels like one of the most natural modalities we have as well, which I really love.
Thank you. I can kind of feel like something youthful in you, like in your voice as you like talk about this. I guess I have this image of this is me speaking just from like my emotional response, not too intellectual, Nate, but it feels like there's this little kid who's just kind of eager to discover things and be together. That's like it feels like there's this energy in you that I'm like resonating with.
I I really appreciate that and feel very seen by that. I think that's another like even as I've heard you respond to each person's like the energy they're individually bringing, I think that's one other thing I love about group is that in a truly effective group, everyone is seen for the gifts that they bring into the space.
Okay. And I'm still hearing you, but my brain is shifting to the next thing. And let's see. Let's see. So we have Susie and Corey and Kristen. So I think everyone there is not able to participate like verbally or with their video. And is that, have you got that? Have I got that right, Amy? And I thought there was
Yes,
someone
we
else who
we had
joined us, but I
one, yeah,
can't
we
see
had
them.
one other that joined. I'm not sure if she is able to come on video.
Okay. Are they, it seemed like maybe Jackie, are they here
Yes,
still or are they
it's
gone?
Jackie. Let me see.
I'm not seeing them actually in the person lineup.
I don't either.
So maybe if they come, they can, we'll try and wrap them in.
Okay.
Okay, so
Right.
let's see.
Go next.
Thanks, Susie. I wish I could. Paul, I appreciate your warmth and the sense of inclusion you've already created. Thanks. Thanks, Susie. It helps me too to hear from everyone.
I think Claire Julian um needs to
Yeah, I
go.
could go next. Yeah, Jackie
Oh,
was.
Claire. Oh, Claire, I was just sitting looking at you. I am
That's
like,
okay. Yeah, thank you, Paul, for being here and creating such a wonderful interactive experience with us tonight. I really appreciate
welcome.
it. And I am Claire Julian Carbone. I work at the Mill Creek office with Healing Pathways. I do mostly um, individual therapy. I worked at LDS Hospital on their psych unit some years ago and did some group therapy back then. I have one funny experience I could kind of share with you if I could just take a minute. So it was a
I
group of
hope you
women.
would. I hope you would.
Thank you so much. So it was a group of women, And on one occasion, there's about eight women and myself. And on one occasion, we sat in a circle. One of them was crying, and another of the clients was saying so and so is being released this weekend, and she's planning on this is the one that was crying. She said so and so is being released this weekend, and she's planning on taking bug and roach killer and taking her life when she gets home. And so she was crying because of this prospect. And I had this crazy thought in my mind, this picture in my mind, and I kept arguing with myself, don't say it, don't say it, but I gave in. And so when I said, to the woman who was planning on leaving and doing that, I said, this is really very sad to hear. I said, there's no one that could really replace you. This is going to be very difficult. And then I said, and I really hate the thought of you lying on your back with your little feet wiggling in the air while you're croaking on bug and roach killer. And everybody in the group just burst out laughing, including the woman. And it just took the solemnity out of all of it. And I think everything turned out well. But that was an interesting dynamic to be presented with that kind of thought, that inspiration, and then having to decide whether or not to share it. But it worked out for the best. So thank you for listening to that.
Yeah, and I'm so embarrassed, Claire, that I was looking for the invisible people, that I missed all the visible people. But I love that you shared that.
Oh, thank you. Yeah.
I don't know exactly how we pick up stuff like that, through the universe or the collective unconscious or mirror neurons, but it's amazing what can like come from within us or outside of us or unconsciously be communicated. That's a lovely
Yeah.
story.
Yeah. I think as a therapist, we really have to be open to those impressions that we get. They're not just accidental, So that time it turned out pretty well.
That's creating an image that I can tell is going to go in there somewhere. Maybe it will come out or be used, but I like that I can tuck that away. Okay, Amy, have I missed anyone else right in front of me?
Let's see. Let's double check. I think we got
I think
Lori.
Corey maybe
I
turned on
don't
the
know.
sound. Were you going to say something, Corey? Okay, I'll go. So I'm going to turn on some slides. I'm going to say the other setup thing that I forgot to mention. Someone in the group world taught me this 3 years ago or so. I learned on Zoom you can turn off your self view. You probably all know that already, but I'll say it anyway. Some people don't like to turn off their self view, so don't turn it off if it helps you to like be more present. But similarly to like an in-person group, as I was saying, we don't have a mirror in front of us, to kind of watch our every move while we watch everyone else. So I found for some people it can help them be less distracted. So I would just say if it helps you, turn off your self view if you didn't. Okay, I'm going to pull up my slides. And then find my share button. I closed about a third of my tabs right before, but I still have a lot of tabs open. When you do 5 hours of marketing or just live like me, you have a lot of tabs. Okay, can you all see that? Okay, here's my title and name. We don't heal in isolation, the power of group connection in trauma recovery. Okay, this is my plan. I put it in four items. Kind of introduce each other within our group. I think we've done that now. Then I want to go through some general group process tips and then do an experiential group. In the description, I wrote that we do an experiential group, but I'll leave it up to us. So we will have a choice that we could do an experiential group right now. So we can I think one of the best ways to learn about group work is by like seeing it and even better, like doing it. And so I don't know how that will go, but I think sometimes we call that a demo group or a demonstration group, but we have that option. But I also have a backup plan I have a video, which is actually very good. Uh, and so we can watch that. I'm not sure it will be as good as doing a group with ourselves, but that is very good. We don't have lots of people here. If we had lots of people, I'd say just we could do the demo group with a subgroup of us. Anyway, we'll talk about that in a little bit, how we want to do that. And then in the end, I was hoping to debrief whatever we do and then kind of open it up for questions. And I didn't put on the word discussion, but have some discussion. Okay, anyone have any questions about my plan? Okay. Let's see. I think I don't want to take too much time because I'm watching the clock and we don't have that much time. But again, my name's Paul. Let's see. I want to tell a little bit about my group story. Let's see. I'm going to hit a few highlights of my life. Hopefully, can make myself a little more present. I was born in Southern California, and when I was 5, moved to Utah. Grew up in Bountiful, Utah, where I am right now. My business is in Bountiful, Utah. I live in North Salt Lake, but grew up in Bountiful. And I remember somewhere in high school, I went to Woods Cross High School, and I remember talking to two people. It kind of like blends together, and I can't quite tell if this was two conversations, but in my mind, it was two, but it also is kind of merged. I remember talking to people, and I had this impression that I could help people by talking to them and listening to them and attuning to them. And I thought, I kind of like this. And I thought, people got paid to do this, and I think I could do this. My other option was be an artist. I was really into art. I think these like counseling and art, I didn't really realize at the time that they're probably very related. But my curious and I maybe emotional side, they kind of both play out in art and counseling. And I decided to go with counseling instead of art because I imagined if I was an artist, I would be in these studios for long hours and isolated. And I thought, being a counselor, I didn't have these words for it then, but it's kind of like being to a mental health gym. And it's hard to, it's like an athletic trainer. It's hard to not be somewhat healthy if you're, doing it all day. And I thought it'd probably be better for my mental health if I did counseling. So I decided to work with people rather than just work with paint and clay. Fast forward, I got my psychology undergraduate at the U, and then took a couple years off and then went back and did the CMHC program at the U. And this was the moment I've identified as the birth of the group therapist inside of me. At some point, I looked at the syllabus and it said group psychotherapy. And I don't know if it was something in the universe or something in me, as a being in the universe that said, like something like lit up. And I didn't know that would be like a primary professional identity or part of my primary professional identity. And it's still growing now. But I think that was kind of the moment that it said group therapy. That's the thing. And so I took the class and I was so disappointed in the class and it didn't work out very well. People got in arguments and so I took another class at the U, and that one was okay, but there's nothing experiential. And anyway, I've been on the hunt for kind of good therapy stuff. And about 5 years ago, one of my kind of advisor or mentors turned me on to a certain kind of modality that I found really helpful. And so what I'm presenting today is some of the steps on that. So it doesn't quite bring me up to date, but that's mostly brings me up to date. So I had planned on this slide to ask, kind of do a go around again, but I think I won't do that, but for time's sake. But I'd like to encourage you all to just kind of think about what is your experience working with groups and what groups have impacted you, for good and bad. So professionally is kind of the first question, but also personally. So I'll be quiet for like 10 seconds. So you can kind of think about this inside. Probably not quite 10 seconds, but it comes to mind some really bad experiences I had in groups. I think it was really hard, some of my peer groups. And I think I always thought my family of origin group was good, but over time I realized some things were not as good as they were. I've also had some really wonderful experiences in groups. Okay, so I'm going to try to go over the slides a little quickly, but not too quickly. There's not too many. Okay, first of all, what is different about group? In the history of group work, from my understanding of the history, some of it started during World War II when they needed to have there's so many patients to treat. They started to teach people in groups. There's some physicians who found that they tell people with the same conditions multiple things, and they found it'd be more efficient to tell people, um, in groups so you can kind of deliver it. So they start to combine people with the same kind of problem and give them the same instruction. And then as some of our history of therapy goes back to psychoanalysis, where physicians tried to start to treat the mind. For a while, groups were viewed as deficient in psychoanalysis, and analysis of resistance and transference are seen as ways to kind of really work in a deep way and help people with their serious or mental health problems. And it was viewed that group therapy created a dilution of the transference, that a transference wasn't as big, so it was not as impactful. However, over time, there started to be this recognition that there actually is a transference process that happens, and we can analyze things, and the group can actually like recreate the family of origin. One of Yalom's therapeutic factors is it can be a recapitulation and have I can't remember the phrasing exactly, but a recapitulation of the family of origin. So we can kind of readdress things and really help look at things. From a transference and an analytic perspective, it also gives an opportunity to have multiple transferences. Sometimes the therapist in an individual setting who's kind and attuned and she is, trained, or he or they are attuned, trained to be really kind of kind. Sometimes they don't evoke all of the same issues, but there's an opportunity for a transference onto, sometimes they say a maternal transference onto the mother group. The group as a whole can be seen as a maternal object, which many people or most people have a positive sense kind of connected to the group as a whole, except I think people who've been really severely harmed in kind of early in life. A lot of times the leader, it's been theorized, can elicit a paternal projection. And the other, from a developmental perspective, some people have said that individual therapy is like sitting on the lap of the mother, and group therapy is like sitting on the lap of the mother with a bunch of siblings running around. So there's that the other group members can evoke other kinds of things. So I guess I'm saying more about this than I wanted to on this slide, but I hope it's helpful. But I'll read here. An important development was the recognition that the group itself had therapeutic value. And some of you commented on that the group as a whole has some therapeutic aspect. And I'll comment here, the loneliness epidemic. There's an opportunity here to work on the loneliness epidemic, what has been called that, and some of your comments tie into that. Okay. I guess one of the things I want to highlight here is the idea that the group leader needs to have the skill to support process. It's like I heard someone say it's like the spoke and hub kind of problem. Sometimes when we're trained in individual work, it's the individual therapist is like the hub of the wheel, and each person is like there's like a connection between the group leader and the individual, and so it's kind of like a bunch of individual sessions connected. So the leader talks to a member, and then they talk back and they go back and forth for a while, and then they talk to someone else, and that person doesn't talk to the other siblings or group members, but kind of talks to them. And so it's like this compilation of individual sessions. But what we really want to do is get people talking in groups and get people talking to each other. I'm a mental health counselor, so I listed some types of groups according to let's see, the Association of Specialists in Group Work, which is a subdivision of the ACA, the American Counselors Association, they identify these 4 categories of groups, including psychoeducation, in which we can, be trained, task groups that have a certain purpose, therapy groups, which might be like treatment groups, and then counseling groups that have particular focuses. But the idea here is, for me, even a class, really any kind of group, we want as therapists and professionals to be able to have the skills to support process, to start to get people talking, even if it's a task group or an education group. We want to be able to say, someone shares an idea. We don't want to just respond to it or answer the question, which is, helpful at times, but also sometimes engage other people to maybe say something like, Nate, that's such an interesting question. Claire, what do you think about Nate's question? Or Lori, Lori, what feelings do you imagine Nate has that he's even thinking about this? Or I might say, Amy, I might kind of give Nate some praise individually, but I'm going to triangulate here, and I could say to you, Amy, isn't that kind of amazing how how Nate's thinking? These are kind of bridging interventions, but trying to intervene in this kind of triangle or create bridges to start to get people to kind of be interacting and paying attention to each other. So here's a picture of the Brooklyn Bridge. I want you to hold the image of a bridge. This is the idea of bridging. This is one of the ideas I was never taught in my first 3 college courses, graduate school, on counseling. Maybe you all in your group training got taught this, but I was never taught this. Is think about a bridge. So I'm here and we want, there's these spokes coming off me. We want to get them to be interacting. Okay, here's some examples. These examples are, I think, excellent questions, but they're oriented to help someone think kind of intrapsychically and how they relate to themselves. They're not interpersonally focused, even though I think they're great questions and there's certainly a time for them, even sometimes in group. The first one, John, why are you so quiet? So we get the question directs, John can answer any way he wants, but he's probably not going to interact with his neighbors. He's probably going to look inside and kind of think about it. He might say, oh, this is the reason. Or he might get reactive and say, no, I'm not quiet. The second question, Edward, how do you think all this started in your life? It's inviting Edward to look back in the past and kind of reconstruct his own history, but he's kind of ignoring his group siblings. Or Alice, you say you criticize yourself too much. When do you do it? So it's looking at the behavior and getting more specific, but it's not interpersonally focused. Here are some other alternatives that direct people to think about other people. That's your pattern too, Felice, isn't it? Don't you always also avoid men who seem wishy-washy? So it's kind of a flippant comment, which I kind of like that, but it's someone's talking and then they go to someone else and say, don't you do that too? And so they start looking at each other and they think, oh yeah, they do. Something in them is located in me. Or they say, no, that's not right. But they're not focusing inside, they're looking at each other. Although there is an intrapsychic piece too, but there's an interpersonal focus. What do you make of George's silence concerning his troubles with his wife? So whatever's going on with George, or maybe George is just not talking, a bridge can be used to bridge to someone who's quiet by not saying, why aren't you talking to George, but asking someone else, Ralph, what do you make of George's silence today? He hasn't said anything. And then Ralph starts to talk, and then it gives George actually insulation by not going directly to him, but we go to Ralph and he's going to start to think for George. And then George can just listen and he's getting attention and he can take in the benefits of that, but then he can also talk if he wants to. I might even protect George, trying to protect him from scapegoating. It's another thing I didn't get taught early on, is how to support people who are quiet, but not scapegoat them. And so I could say, George, I think you have a good reason to not talk. I'm just going to ask Ralph a question. Ralph, what do you make of his silence? He probably has a good reason to not talk, but what do you make of that? And so we're bringing in Ralph bringing in George while he can be quiet or not. Okay, Henry, do you know anyone like that? So someone can be talking and we go to Henry and say, do you know anyone like that? And so we're kind of inviting, there's this idea of a doppelganger. We're inviting Henry to like think about someone in the room and find a doppelganger, someone else who's like that. It could be someone outside of the room or someone in the room. Okay, I think this is the last example. Does Peter's treatment remind you of anyone else's in the past? So this is looking for a doppelganger who's not necessarily here and now. They may be in the past, but we're just trying to help kind of think about things and talk and connect different people. Okay, one other idea I want to share that's helpful is in addition to bridging, is use of immediacy. This is a here and now focus. We want people, well, one way to avoid intimacy is to talk about something that's not in the room. So someone's telling something about anything that's happening somewhere else. They're not talking about what's going on here. If someone talks about the past, I did, even to a group member, I did feel this way, or this did happen. Talking about the past is a way to avoid intimacy. Sometimes talking about the future can seem like the immediate, but it can actually be an avoidance. Like saying, Lori, if you would just talk more, I think I would really like you. You're just too quiet. Forgive me for using you as an example, Lori, but I just see there's not too many people's faces I can see. So I've got to pick on someone that's in front of me. But sometimes saying like, if you would, or I would feel this way, that's kind of like a what if statement going into the future instead of saying what I do feel right now. Um, like I'm nervous or I'm scared or I'm feeling desire or some other thing. So thinking about how are group members avoiding the immediacy in the here and now, in the room and right now. We really want the group members, as I said in this third bullet, we want group members to talk to each other, to interact personally. One
Can you,
way,
before you
yeah, go
move on,
ahead.
I'm a little, this is new concept for me of um, the use of immediacy. Can you give some more examples of how people are avoiding immediacy and also how to know when we're in immediacy?
Yeah, let's see. Through some examples in my mind, Lori, and trying to pick the ones that will hopefully be useful. If someone is, I guess this is an example, maybe some others will come. If someone's talking about something that's not in the group, I might say, I wonder what happened right now that made you think about that. Earlier with Claire's story, that was a story that like felt emotionally present to me, and I didn't have to like ask about that. And I think when the story feels kind of alive and connected, that I want to
Like
just go with it.
when it tracks.
Yeah, but I still could have said, even if I wanted to hone it in, I could have said, Claire, I wonder if you can also like, I love that story. And I do love that story of the dying like a rat from the rat poison, suicide. Um, but I might say, I also wonder if you'd be willing to share what specifically happened in our group that made you think about that.
Oh, okay.
Or if someone's
Just kind of
talking about,
bringing them back. Like, okay.
yeah. Or I might say, you've talked all about this mother of yours. She's very difficult. Or someone might tell a story about their teacher when they're young, that they just kind of keep going on and on. And I'm thinking, what does this have to do with here? And I might say, this is so interesting, and it sounds like an important part of your history. I wonder if there's anyone in this group who reminds you of that teacher. And they'll probably say, no, no. And then I might say, well, if someone did, who would you guess? Who's the most like that old teacher? And usually the second time they're like, well, so and so, so and so's over there. And then it's like it unlocks the power in the group. And if someone tells a story about their mother or their wife or their father or a teacher or someone else or their sibling, I'd say the odds are probably high that there's something in the group, even if it's out of their awareness, is reminding them of that story. And it's safer to talk about the teacher than to say, you
You
know,
remind me of that
hey,
person.
Johnny, you remind me of my teacher. Yeah, you always cut people off and you're very rude. But if we can kind of bring it in there. And then if they kept denying it, I might say, well, probably it's just a coincidence, or maybe it's a coincidence. I don't always believe in coincidences, but sometimes probably it might be a coincidence. But I might say it's just kind of interesting. Sometimes when people, I've just noticed over time, maybe it's not happening now. Sometimes when people talk about something, sometimes it is relevant. So I'm just gonna try and keep in my mind how it might be connected to what's going on in our group.
Thank you.
Another example, let's see, one other example could be interpreting someone's nonverbal behavior. I might say, Lori, I notice Claire has been looking around. What do you think might be going on with Claire looking around? And I don't see Claire looking around in our actual class, but if I have in my mind it might be bored, or maybe Claire has a lot of emotion and something, but try and interpret that and bring it in to kind of put it into words. Am I satisfying you with my examples, Lori?
Yes. I don't know what I just clicked, but I lost there's the um sorry, technical difficulties here. Yes, that helps me. I just haven't used that phrase of immediacy to
Hmm.
identify when people are not in the room.
Yeah, yeah, can be helpful. What do you think of that idea, Lori?
Part of my brain is
Thoughts?
distracted because I just clicked a
Oh,
button and now I don't see anybody but myself. I don't know how to get it back. Um, but the idea of the idea of like when you were saying, Lori, what do you think of Claire's looking around? When I've been a group participant, it was a really rigid set of rules. There was like no
mhm.
crosstalk, so that would have been like a straight up no. So there's a
Oh
part of me
yeah,
that's like, ooh, like, oh my, um, kind of. I would feel a little put on the spot. So I'm
yeah, yeah.
curious, what kind of like prep do you give the group participants to know, hey, this is going to happen. Like I'm going to use all of you for all of this. And if I call on you to reflect on other people's behavior in the group,
Yeah.
um, do you prep them for that?
Oh, that's a good question. I try to, but probably it takes time to get used to it, even if they're prepped. But I do a pre-screening interview, and I give people paperwork. And in that, everyone in my process groups, agrees to the contractor group agreement, which is to try. It includes, you know, come on time, end on time, pay your bills, um, try to take an equal portion of the talking time across groups. It includes, when you come, try to share the emotionally significant story of your life. But it also includes, I think that's the most important thing, to try to notice your thoughts and feelings toward each other and then put them into words. And so, but we're kind of breaking some social norms, or I am, by inviting people to talk about each other. But that's really what we want to do. We don't want to follow social norms. We want to put into words all this stuff so we can kind of deal with it and really directly. But a lot of times people, yeah, they kind of push back or might feel uncomfortable. But over time, I think people get used to it. And if someone starts to feel awkward, I didn't put a slide into this, but I think it's helpful. I might pull the aggression toward myself, and try and away from like self-attack and say, yeah, this is very awkward. I'm really interested in what you guys think about each other. So I do this thing, but it is very awkward. And
Mhm.
I've certainly had people tell me. Boy, this is kind of weird. I'm not used to this. Is this okay to do it? And
Yeah.
I don't want crosstalk where like multiple people are talking at the same time. I don't want that kind of crosstalk, but I do want interactive talk. And I don't want to try and hold the whole group and just have people talk to me and I talk to them. That's going to be very hard as a group therapist, and we're going to lose a lot of power of the group. Okay, those are
Thank you.
great questions. Yeah. Okay, any other questions? Okay, some of these ideas come from this text. This text was the first introduction to some of these ideas. I think it's excellent. It was written in 1992 by, as far as I know, this may have been the first person who had a private practice solely based with groups. Louis Ormont. The book is The Group Therapy Experience from Theory to Practice. It's a little old. 90s, I weren't. Okay, it's getting to be a while ago. 92. I think I was in junior high, finishing junior high in 92. If you're interested in these ideas, he explains them a lot more. So that's my last slide, and I took more time than I was wanting to, but it seems, I hope that was helpful. Okay, at this point, we have about 39 minutes left. I wonder, would you guys like to do kind of a group with a demo group here, or would you like to watch other people doing a group? I saw some like several micronauts. Do you want to do it here? Okay. We're going to be a little small, especially if we have 3 or 4 people not participating, but I think it'll be okay. Okay. So maybe I'll start. Let's just kind of jump into it. I think I'd like to try to go so we have like 15 minutes left to discuss it. And we'll just kind of see how it goes, but approximately go till 7:45. So that's not really a lot of time. I wish we'd had more time, but it's also I only had 90 minutes altogether. Let's see, I'm going to suggest some group agreements. One is confidentiality, whatever we share. Don't share that with anyone else. You can share your experience, but don't talk about other people's stuff. I would encourage everyone to try and say something, or approximately take an equal portion of the talking time, although there's not a lot of time. But with a small group, there's probably at least a few minutes. I'd encourage everyone to just consider, first of all, oh, bye, Corey. Um, I'm glad you were here, Corey. Have a good night. And let's see, I'd encourage everyone to maybe try and share like one thing that's vulnerable, but also limit your self-disclosures. This is not really psychotherapy, although it certainly could be therapeutic. And and I wonder if everyone can agree, whether you say it or not, to try and just notice your feelings and thoughts toward each other. It might be positive, might be negative. And and I'm guessing we'll talk about the topic of groups. Anyway, how does that sound to everyone? If we had more time, I might ask for more of kind of feedback, but how does that sound? I guess can everyone try and look at me and just kind of nod verbal if that kind of sounds good, or if not, okay. What Claire, what do you think about that? Our micro group agreement.
Yeah, no, those are great. I was just thinking in terms of sharing what makes us vulnerable, like that's a lot to risk at the first our first group meeting. But
Really small, on a scale. When I did EMDR training, they said, in the practice, something really small. So like a 1 or a 0.5.
hmm.
So maybe not. If yeah, just to consider, maybe consider. Okay, well, let's just start.